Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you can join us for another segment. In this segment, we're going to be speaking with John Bracaglia. He's joining us here as CEO and founder of Marvin. He's going to tell us a bit of his story, talk about why he launched Marvin, exactly what the company is involved in. Welcome to Health Professional Radio, John Bracaglia. Thank you for joining us.
Thanks for having me. It's really nice to meet you.
Well, tell us a bit about yourself, if you would, and then talk about what Marvin is and what the company is involved in.
Yeah, so I'm the co-founder and CEO of Marvin, and Marvin is a digital mental health company. We provide support specifically for healthcare professionals, partnering with hospitals, other large healthcare organizations, and providing mental health support for their employees and staff. And, Marvin, my background primarily is in healthcare and technology. Spent most of my career at Google working on their digital health initiatives prior to going to business school in 2017, where we had started the company from there.
Talk about some of the health systems that Marvin is already working with.
And we work with both large integrated delivery networks like Cedars-Sinai in Los Angeles, UCSF, Jefferson Health in Pennsylvania, as well as local government organizations like the Healthcare District of Palm Beach County, medical societies, and smaller health systems, really trying to work with a variety of organizations to help their members and employees access care at the time that they need it most. So I had moved to Boston in 2017 and really felt like I was dealing with a lot. I was in a new city, working towards a graduate degree, feeling a little unsure of myself, and met with a therapist there. I met with a therapist before in my life and felt like while they were nice enough, they didn't really understand what I was going through. And later while I was studying, I met my co-founder Aparna, who in the common room, sort of at school, who was a therapist, a psychiatrist. And speaking to her, realized that even as a physician, she felt like she was dealing with the same issue, and she works in the field. And for her, it was even more challenging. She, as a resident, was working very intense hours, way outside the 9 to 5. The experience, if you know any medical residents, it's certainly a unique one. And, she talked to someone and just didn't feel like there was a real understanding, to the degree that they said something like, hey, why don't you try to work less? And as a resident, it's not much of an option. And, really felt like there wasn't that sort of deep empathy and understanding. And so we recognized that, particularly for healthcare workers and perhaps for other high-intensity, high-stress roles, that really finding someone who understands what you're going through these sort of dynamics is hard. And that was before the pandemic.
Exactly how does Marvin work? You mentioned that it was a digital platform, a digital mental health platform for healthcare workers.
We're the first mental health program made specifically for physicians, nurses, and other professionals working in a healthcare setting. Mm-hmm. It's a concierge-level program. It's really developed in partnership with health systems and providing 24/7 care. Now, that starts with our therapists, who we're scouring the country looking for therapists who really specialize in this population. And when they join, we're working with them through a training program to really detail and understand the lives and lived experiences of what it's like to be in a health system or a hospital. But more so, we offer 24/7 hours, measurement-based care approach, which really is meant to focus on the healthcare worker themselves, helping them build new skills and be the best at their performance. And Marvin, while we work with individual providers, we also work with the healthcare system as a whole, acting as a strategic partner, really trying to help them understand, are different departments burnt out? Are there different areas and challenges? How can they be best in touch with the mental health of their workforce in an anonymous, completely confidential way, and improve so that they can help their employees and, at the end of the day, be the best for their patients.
Is this exactly like it would be for someone being referred to a mental health specialist, a mental health provider? Is this something that their doctor can prescribe, or is this totally on a person's own desire?
Marvin is completely outside of the health system and very much intentional. It's no secret that in healthcare, the stigma of seeking support is real. And so we really try to be completely separate from the workplace, although we partner with the hospital to promote it. and are completely outside of the organization. For the sessions themselves, we partner with insurance both locally and nationally. Insurance providers like United Healthcare, Aetna, Cigna, Anthem Blue Cross, and are an in-network provider. We accept the insurance of the health system employees that we work with, really trying to deal with that messiness and have a tailored behavioral health solution and networks to accept the insurance provider of our patients.
Well, you mentioned the reluctance of some professionals to seek help. How does Marvin navigate some of the possible stigma associated with healthcare professionals seeking other healthcare professionals?
It's funny, but often healthcare professionals, they're almost the last people to ask for help when it comes to mental health. And in some ways, medicine is almost similar to a military culture or a hierarchy where you assign personal value to putting others in front of yourself. And putting yourself first can be even a sign of weakness. It's almost like if you put yourself first, you're taking time for two people. And you're taking time for both yourself and your patient. And so, there really is that sort of challenge and that mindset, which we're trying to break. And, one way to think through it is really to tell the stories of people who've been able to successfully helped by the mental health system. And that's sort of using the language, having physicians talk to physicians, nurses talk to nurses, other people in the health system talk to some potential people who need help and telling their story and telling the value that it had. We also try, to have leaders at the hospital talk about the value of mental health and really sort of destigmatize and make the whole process feel accessible and useful.
Is it exclusively a telehealth platform? Are there other avenues of access? Can you interact on your phone?
It's telehealth only, so nothing in person, but available on both phone and desktop. Really meant to be 24/7. So if you want to talk to someone at 2 a.m., we have people who do that. Not I would want to talk to a therapist, but certainly if you'd like to, that we're there and really trying to be there for you at the time and place that you need it.
Is there anything that you'd like to add for our listeners, and then give us a website where we can learn more?
I would say, unfortunately, the mental health challenges of this population, it's been an elephant in the room for a long time. And there's always been a stigma around seeking care, but the pandemic really exacerbated it. And so, if you're feeling this challenge, you're feeling like you may be able to be supported, that we encourage you to reach out and to do so, because there's a lot that a mental health service like Marvin or even others can do to help. Our website is meetmarvin.com. It's meetmarvin.com. We'd love to connect with you.
John, thank you so much for your time. Appreciate this information. And hopefully you'll come back and give us some updates as Marvin progresses and helps people out.
Awesome. It was great to meet you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with John Bracaglia. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, Anchor, Spotify, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.